Thanks everybody. So I will begin with a little introduction again. So I'm Eleni D and my business is called Meraki Health. I'm a certified health coach and I have a real passion for helping individuals from children all the way through to people who suffer with different chronic pain conditions, find different aspects of their lifestyle to improve their health and well-being. So I will talk a bit more about myself in a second, but first I wonder, just wanted to sort of have a disclaimer to say that any information that I mention here is for educational purposes, and if you choose to take something on, you might want to check it through with your medical professional. So we'll be talking about what is chronic pain, discovering the role of inflammation and how that leads into chronic pain. We'll be looking at lifestyle choices and how that impacts pain. And also we'll find some methods that can enhance pain through these lifestyle changes. So I wonder, anyone here have experienced pain? Please put your hand up. So that's most of the people here. If you haven't, wow, well, that's amazing. Well done you. If you've never experienced pain, you're very lucky. And for those who did put their hands up, I wonder, have you experienced pain for longer than 3 months? Yeah, so a couple of people. All right, brilliant. So now we want to lead into a discussion on what the differences are. But before we do that, you're probably thinking, who is this woman before us who wants to talk about pain? What does she know? So I'll go into a little bit about my background so you know where I'm coming from. So my journey into health coaching, it's not where I began. I started my journey with pain, living with pain myself. So I was diagnosed with a blood disorder at a very young age, and that led into a lifelong management of pain. So during my childhood, I grew up in North London, and I would describe my second home as the Whittington Hospital in Archway, if anyone knows it. So that's where I spent a lot of my time, especially as a child. That's quite difficult. So I have a condition called sickle cell anemia and beta thalassemia, and that causes a lot of chronic pain as well as acute pain that leads to severe crises. And this is a breakdown of the red blood cells and oxygen levels. It's quite complex, I won't go into it, but that's where it all began. So that's a genetic condition, and my family found out that I had that at around the age of 2. So I went on through my childhood until about 18. It was a difficult time, in and out of hospital, trying to be a child and do what others were doing, but I couldn't really do the same thing, so it was very challenging. At the age of 18, I started a new medication, and at that point I felt like I'd started my life. So I was quite a bit of a rebel, and I wanted to push through all the barriers and go and do things and do what my peers were doing. So my journey went on to go to study at college. I was passionate about computers at the time. I then moved on and went to university and studied computing at Greenwich. I managed to fight my way out of home, assured my mum I'd be okay, and started to learn how to look after myself. So I was very happy to complete my degree in computing with a Bachelor of Science, and then continued this new life of what was normal on the outside, but underlying still having to manage this condition. I started working in computing in London at Regent's College. I met my boyfriend at the time, and then we made dreams about going travelling together. So we saved up and decided to take a big journey and do a round the world trip together. So then we thought, you know, all right, it's a big thing to go travelling for about 9 months together. We made a little pact and we said, if we come back together, we'll stay together. And if we need to part ways, we'll say thank you for the memories. So off we went. I had a lot of preparation to do when you have a chronic pain management system and lots of, you know, background things that you have to take with you and letters from the doctors for your medication. So it was a hefty backpack. But we did it. We went around the world and we came back together. So we continued our journey and we got married. Fast forward, we moved, bought our home, all the usual stuff that comes with that. And then I found out I was pregnant. Now, I wasn't even sure I could become pregnant, but so it was a lovely surprise. Now, the downside was I had to stop my medication. And unfortunately, at this point, my health deteriorated quite significantly. So I had a very difficult pregnancy. But despite that, my lovely little baby girl was born a little bit early, and we had a little difficult time in hospital, but eventually she was well, and eventually I managed to go home as well. Now, at this point, I really had to delve into discovering new ways to look after myself. So up until that point, it was really just about myself, but suddenly I had a new person to look after. I had a new reason to live. So I started to look after my nutrition a bit and started to delve into what things I needed to feed her with as well. So the journey began in this educational sense. Then I tried to have a second child, so I wanted to be as healthy as possible. And a few years later, I was pregnant again and managed another difficult pregnancy, and then a successful little boy, also born early, but he was absolutely fine as well. By this point, I knew that I really had to find more ways of how to live longer, because as a child, I was told that I might not live past the age of around 40. So it was a very new way of having to meander life. So my journey continued and my pain levels deteriorated. Although I was back on my medications after pregnancies, the side effects were that the degeneration of the bone due to the condition was becoming quite difficult. And I found out that both my hips had collapsed because of a condition called avascular necrosis, which means the death of the bone. So I stand here before you today living with pain. I have had one hip replaced and one that needs replacing. But at the time of going through this, I had to make the decision to really find a way to live for these babies. So I really kept going deeper and deeper and deeper, all the way to the point where I decided to retrain as a health coach. And that was just over 5 years ago. So that was in fact during the pandemic, so it kind of coincided really nicely for me because I was able to be at home and study, and I was studying with the College of Naturopathic Medicine. As you know, the world went online back then, so it was easy to carry on the studies. Also kept me quite sane during that period of time with young children. So I managed to get my diploma, and then I started to work in this new supportive field. And this is my family a couple of years ago, so they are growing rather quickly, and the joys of being able to raise them and be alive is what keeps me going. So although I stand here and many people don't see the pain that I endure, it's often referred to as an invisible disability. It coincides with a lot of tests and a lot of treatments, the hip replacement and knowing that I need another one, but there's complications around that. I have to find balance it's not just about one thing, it's not just about one solution. It's finding a way to integrate lifestyle choices in order to be the best I can. So I take all my knowledge and all my expertise in how I developed myself, plus my health coaching, to try and help others. So I have an approach that I have come up with and a little acronym. It's called, I say ESSI because it's from a Greek word and that means you. But what it translates to is empathy, support and education. And this is how I believe most people will have success from a goal that they're trying to achieve when it comes to health and well-being. So over the last few years I've been developing my work. I have been working with the children's centres in Waltham Forest for a charity called Henry. And they are a lovely charity. They are national, but I work just in Waltham Forest at the moment. And that Henry stands for, so it's not the Hoover, if anyone thinks, oh, Henry the Hoover. No, it's Henry, so that stands for Healthy Exercise and Nutrition for the Really Young. So we go into children's centres and we help families with the under fives. So anything from the point where they're starting to eat solid food, and we do workshops around that, all the way up to parenting programs in the children's centres to help parents meander those different parenting skills that are needed and different lifestyle choices that impact the health and well-being of the children. I also have been developing group programs and workshops for the Red Cell Network at UCH. So the Red Cell Network is looking after people with red cell disorders, and it's been a privilege to be commissioned and develop these programs for patients and parents of children who have these conditions. So, as I said, I like to educate, and I like to do it through interactive ways. I don't like the boring whole list of information that anyone can read off the internet these days, and then you go home and you completely forget about it. Really, making lifestyle choices with that supportive, empathetic and educational combination is what leads to people actually making positive change in their lives. So the work I do is through one-to-one coaching, I do workshops, and I also do masterclasses. I like to really show people how to read food labels and demonstrate things, and also different activities on how to work out where sugar is in drinks and stuff like that. Okay, so we'll move on to today's topic. So, just have a sip. What is chronic pain? Now, chronic pain is something that is described as a pain that will last longer than 12 weeks. It is something that persists regardless of an injury that has healed. And it's something that will continue to bother someone after maybe surgery, healing has subsided, or other injuries aren't there anymore. So that's quite different to chronic pain, to acute pain. So the acute pain is that essential pain that you will get at the immediate time that you cut your finger, twist your ankle, or have a significant impact. So there's different descriptions on that pain. It could be anything from feeling a dull, sharp or burning or aching type of pain. It could be a combination of all of it. Also, it's the different signals that are sent around the body and whether they have miscommunicated Maybe there is no actual thing there for anyone to see anymore, but the pain persists. But all pain does serve a purpose. It's trying to tell you something. So pain is real, even though it might be invisible. There are 10 conditions, the top 10, so there's multiple conditions that cause physical pain, but there are a top 10 that you might have come across or experienced yourself. So these include anything from nerve pain, post-surgery pain, fibromyalgia, injury-related pain that persists, back pain, spine problems, arthritis and joint pain, genetic connective tissue disorders like lupus or rheumatoid arthritis, internal organ pain, and even sickle cell disease and cancer-related pain, whether that's from cancer itself or the treatments for cancer. Underlying the pain is inflammation. Now, this I like to describe as a fire. So a fire that never goes out. It's always there niggling, small, constant and damaging over a long period of time. Inflammation is the body's natural defense against injury or infection. And acute inflammation is that short-term, helpful inflammation that is required as part of the body's healing process. However, chronic inflammation is when it persists again. So it carries on after it should have subsided for the purpose of the injury or wound. And that persistence can be low grade, you know, something you push aside and it just accumulates and accumulates into something bigger. And that can become quite harmful. So a lot of people ask, so how do I know if I have chronic inflammation? So underlying the reason that you might have this inflammation that has lasted longer than it should might be things like low blood sugar imbalance, so maybe pre-diabetes or diabetes itself, or it could be different stages in life where that blood sugar balance is not as it should be. Maybe there's high cholesterol. You might experience pain and fatigue. You might be overweight or suffer with obesity, or tend to eat lots of sugar and processed foods. Maybe there's digestive issues or gut health problems like IBS. So chronic pain feeds stress. It can be quite a stressful situation to live in pain. And stress feeds pain. So it's very easy to get stuck in a loop. And what you see here is that depending on anywhere that you start really, if you start with stress, and that increases inflammation because of the chemical signals to the brain and pushing out that pain to the body, which leads to inflammation, and then that gets worse. The pain gets worse, your fatigue gets worse. You have issues with mood and temperament, lots more tension, which then adds to your stress. The pain increases and triggers that frustration, and the loop will continue. So we need to work out a way of breaking even one link in this cycle through rest, movement, connection, mindfulness, anything to reduce the intensity and impact of the chronic pain. So lifestyle factors play a big role in the levels of pain that people experience. And knowing where these things are in your life, and it might not be the same for everybody, but getting an idea of what they are and finding them means that you can start to make those little positive changes into removing that pain. So things like food, looking at what you're eating and changing into an anti-inflammatory diet. Hydration is a big key that a lot of people forget about. Stress management and different techniques around that. Limiting triggers to pain. So, you know, depending on what your pain is, for me, a whole day of maybe working and juggling the family could mean I'm absolutely exhausted by the evening and my pain levels are through the roof. Then it's thinking about that movement. It doesn't mean you have to go out and exercise. It's about finding out what you can do for your body to keep moving. Sleep is absolutely massive. Being able to sleep through the night during that time where your body is going through its healing process is really, really crucial. So finding out what's not allowing you to sleep or not allowing you to sleep well is so important to then find out how to make that better. So by trying to find something that fits in your lifestyle to change means that you can then go back to breaking that cycle. So just remember, you don't need to do everything at once. This isn't a one-size-fits-all. It's information that has to be tailored to yourself. And with small steps consistently taken, that's how you can help yourself lead a healthier, happier life, despite the pain that you might be living with. So there's lots of other holistic methods that coincide with the lifestyle choices you can make. And these are just a few of the many that I've learned that there are vast amounts more out there. But things like acupuncture and reflexology is one of my go-tos. They are a great pain reliever. I even have my personal reflexologist right here. And other things that like meditation and Reiki in a more spiritual sense can help. Massage therapy, salt caves, which helps with breathing in that salt air. So those are popping up around the country now. I have tried them, and that's similarly if you've able to go abroad and feel the sun on your skin and breathe in the sea air. That's the sort of relief that can help. So Epsom salt baths or sea swimming, cold plunge. It's not for everyone, but it's they're showing more and more evidence now that cold plunges in really cold, possibly icy water has a reduction of inflammation in the body. Other things are myofascial release, and that is a little bit hands-on but not very manipulative, but it targets that connective tissue. And then there is red light therapy, which is something again that's popping up in lots of different holistic clinics nowadays. And there's more and more science coming out for that to say that that's been really beneficial in helping anything from an acute injury all the way to improving people's sleep and eyesight. So lots of things there that you can try, and like I said, there's many more out there as well. Now, if we start to think about food, we start to think what you eat on a daily basis and how that can impact the inflammation levels. And while that inflammation is building, those pain levels will then be increasing. So our body responds when it's under attack, and when we overconsume these foods, especially things like ultra-processed foods, constant snacking and sugary drinks, or even fried foods, that can really impact the inflammation from the inside. So what is an inflammatory diet? What does it look like? So highly processed and artificial foods. So the obvious one, refined sugars, and that comes from sweetened beverages, baked goods, ice cream, sweets, sauces, jams, corn syrup, many different varieties. Then you have gluten-based products, such as your standard wheat bread, crackers, baked goods, and many ultra processed foods as well. Refined oils such rapeseed, canola, and hydrogenated oils and margarines can impact that inflammation in the gut. So it's good to reduce those. Fried foods, chips, meats, donuts, and fast foods. I'm sure everyone knows that they're not ideal. And also processed meats. So though anything packaged and things like hot dogs, sausages, bacon, and charred meats also can have an impact on inflammation if consumed too much. Okay, so next I will have a sugar activity. Should we break now? Is this a good time to break, or do you want me to carry on?
It's about half an hour, yeah. That's absolutely fine. Yeah.
Okay, so after the break, we'll come back and I have a little activity to get you thinking that you might not know about. So that's why I love doing the sugar activity, and I do this a lot with families because obviously if they're raising children, most of them don't know what's in what they're giving the kids. So hopefully, you know, many of you might know, but I hope maybe you might pick up another tip or two. So, sugar. Who doesn't love sugar? So the NHS guidelines for daily sugar intake is 30 grams for an adult. So 30 grams, any ideas what that might look like in cubes? Any guesses?
About that, 2 cubes.
2 cubes? That would be reasonable, maybe. Could you have 2 cubes in a day? Yeah. Yeah? Okay. Could you have more?
Yeah. Easily.
Very easily, yeah. So in fact, it's 7 cubes. So 5, 6, 7. Approximately 7 cubes of sugar, or 7 teaspoons is the equivalent of that as well, in a day is the recommendation from the NHS. So just bear that in mind as we go through this little activity. Okay, so what we have here is 6 different drinks, and we're going to play guess the sugar content. So what I have is a can of Monster, which is an energy drink. We have a bottle of Coca-Cola, 500ml, standard if you're going for your meal deal. We've got a bottle of Ribena, 500ml. We have a little bottle of M&S freshly squeezed orange juice. A 330ml of chocolate flavoured milkshake. And I couldn't get a smaller one, but a very large bottle of Lucozade Sport. So my question to you is, let's try and put these in the order of the highest sugar to the lowest sugar. So, you know, I'm fine for you to just shout out any ideas, and we'll just start laying them out, and then we'll see how we go. Monster first, okay. So this is our high end. What's next?
Coca-Cola.
Coke, okay.
Ribena.
Ribena. Is that everyone agreeing with that? Maybe Lucozade? So something like this?
Before.
You think before?
The other way.
Okay. So we've got orange juice and a milkshake.
Orange juice and then milkshake.
Orange juice and then milkshake. Are we in agreement there?
Is the orange juice fresh orange juice?
So it is described as freshly squeezed orange
I
juice.
think that's the last one.
You think it's last? What are we agreeing with?
Yeah, I have to check the label, of course.
Should we, so like this?
Okay.
Yeah, okay, fine, all right. So, given the information I gave you about how many cubes of sugar we have in a day, let's start with the orange juice. How many cubes of sugar do we, so how easy is it to drink this with your lunch? Very easy, all in one go? You're not going to portion that out. So first of all, yes, there's a bit of label reading. So this is 350 ml and the description is based on per 100. So I've done all the calculations, bear with me, because I couldn't remember it all. Okay, so we are going to base it on a whole bottle, which like we said is easy to drink, of this orange juice. And we have already said that in a day, the recommendation is 7 cubes of sugar. How many cubes of sugar do we think might be in here?
5.
5? What's the other one? 9. 9?
9, I'll say 9.
Okay, so it's in between. It's approximately 7 cubes of sugar just in that. So if you had this for your lunch, you're done. Okay, so we have 7 there. Next we've got our little bottle of chocolate flavoured milkshake. So again, the chances are you're going to drink all of that, especially if you're a child. I can't imagine them putting half in the fridge. So 1 bottle, what do we think?
14.
Who said
10.
Who said 10? We've got a couple of 10s. So you're close. It is just over 9. Okay. So now we have, so far, there's some order there. So now we have a Ribena. So this we said is a 500 ml bottle. Again, I think it's the average thing that you would buy in the shops. Any guesses on the whole bottle?
21.
Who said 21? Okay. Any other guesses? 15?
12.
18.
Oh, like complete range. So in fact, it's actually just approximately over 5 cubes. So there's less sugar in this whole bottle. So that actually goes there.
In the old days, they had the glass bottles, and they had all the sugar in there. There was no less sugar. And when I was a kid, I used to drink it that time.
Oh my goodness.
All my about 7 teeth were decayed.
Yeah.
I had to take all my front teeth out.
Yeah. Sugar's not good for the teeth.
Are there any sweetness in that?
In this one?
Yeah. Because they might cut the sugar down but put sweetness.
Well, that's right. So because you've brought that up, the government has been trying to make changes in the sugars in drinks, and they are very sneaky. They are reducing the actual sugar, as in cubes, and replacing it with sweeteners and other alternatives. So you do need to look at what's in them. And this one has blackcurrant juice, sugar, some other stuff, and aspartame and sucralose. And sucralose is another word for sugar. So do look out for that. Okay, so next along we have our Lucozade Sport, marketed to you if you're a sporty person to re-energise yourself and hydrate while you're out there having a run. So 20. Right, so I'm not going to go for the whole bottle on this because it's not a normal size bottle. So according to the drink, a third of the bottle is a portion. Now, if you're good enough to share it or portion that out, well done. But that's what we're going to go for. So about a third of this bottle is a portion. What do we think?
15.
35.
About 10. A third would be about 10.
So a third of this bottle is actually 8.8 grams, which is 2.5 cubes of sugar. So in fact, this as a portion will come down to here. Now, if you drink the whole thing, it might be a different story. So that brings us to the high contenders. All right, so let's go with our Coca-Cola. So we've got a whole bottle of Coca-Cola, and it mentions that 250 ml is a portion. So that's half a bottle. How many people actually get a bottle of Coke or a can of Coke and save half for later? It's easier with a bottle. You might drink it later, but not necessarily 2 days later. So let's go with the whole bottle. What do we think? How much sugar cubes is in that?
Yeah. 18.
18? Any takers on 18? Any higher or any lowers? Okay, so for the whole bottle, it is actually 13.5 cubes of sugar, which is 54 grams of sugar. So if I just remind you, a recommendation from the NHS is that in a day you consume no more refined sugars or free sugars of 30 grams. So if you've drank a bottle of Coke for breakfast, I'll let you add the rest up there. Now, if you've had a Monster as well,
Your dad did.
exactly. Yeah, you took the words out of my mouth. So a can of Monster, we believe, was the highest, and you would be correct. And it's not too much different to the Coke. In fact, we are looking at 55 grams of sugar, which is approximately 14 cubes of sugar. So it's easy to add up, especially if you're having a few more of these drinks. And we haven't even talked about food. Any thoughts?
Horrifying. I mean, horrifying. I'm a dental hygienist, so in one of the practices they have the drinks packet on the board and then have the amount of the sugar in granulated form in the bags so people can visually see. Yeah.
It's shocking when you actually see it.
Just right.
Yeah, absolutely. So now, if you think about the children who are being offered any of these drinks, really, and they might be getting that with their sandwiches and their crisps and their chocolate or their McDonald's meal or both.
This is the thing that
So a lot of people go for lunch, get a meal deal.
Yeah.
And pretty much all of those are
Exactly.
meal deal.
Yeah, that's why I want to make it as realistic as possible.
The lecture teaching is out in schools or in the public, no one's aware because I wasn't aware of. And to be fair, I don't really drink a lot of that. If I was aware of it, I'd probably stay away.
Yeah. So, yeah. Sorry, go on.
Children, you come to that.
Say it again, sorry?
Children, their limit should be.
Yeah, so for an older child, so I think it's over six or seven, I can't remember exactly, up to 11, the recommendation is 19 grams. And obviously if they're younger than that, it gets lower and lower and lower.
And then with obesity and then diabetes, which is becoming, they call it an endemic.
Yeah, that's right, yeah.
Pandemic.
Yeah.
Biggest endemic.
Yep.
in the UK.
Yeah.
Which, yeah, just because it's massive.
And it's not just UK, it's most first world countries now are having this problem. And you know, we talk a lot about the dental aspect. Children are having more dental problems. They're having more problems with their speech and language because the food they're given is softer. It's not real food, so that's affecting their ability to speak. It's affecting the growth of the teeth. And unfortunately, the problems accumulate from there on.
With one of them, Eleni, you mentioned the sweeteners, aspartame, sucralose. What are your general thoughts about sweeteners? Because most of them, from what I can gather, have health hazards. There isn't a safe sweetener. Maybe apart from stevia, maybe.
Yeah, exactly. Stevia at the moment in the current science is meant to be the best option, but it's not always found in these ultra processed things that are marketed to you to buy quick. Unfortunately, things like aspartame have been linked to causing the development of cancers. And also the fact, like I spotted with this, it also has sucralose after it has the sweetener in it. So unless someone learns how to read these labels, which are a minefield, you don't know. You read what is marketed to you at the front. You know, I'm really healthy, I've got vitamin C, but actually, is it worth that when you've added in the sugar and the different sweeteners and the causes that they have? Yeah.
Would you say a teaspoonful of honey is equivalent to a cube of sugar?
Approximately, yes, but they interact differently in the body. So yeah.
So you can have more honey then?
Not necessarily more, but it's a good alternative. So my take on it is always, look, if you love a Coke, have it sometimes. We've got to be realistic in the world that we live in. But it's not something you should have all the time. You know, same with the cakes. You know, I don't teach this stuff and then say I'm never going to eat cake. It's part of our lives. Everywhere we go, there is going to be this thing. But it's about making the right choices.
You mentioned cancer with aspartame. There was a video that came out many years ago called Sweet Misery, and they were linking studies showing it related to neurological damage, like so MEMS patterns.
Yeah.
Is that still the case, do you think?
I don't know. I haven't seen the research on that, but I wouldn't be surprised that, yeah. In fact, just today I put on my social media a post that I'd seen that because of the changes that the government are trying to make to help things become healthier or look healthier, they have renamed aspartame. I can't remember what they've renamed it to. I think it was amino sugar or amino something. I'd have to look it up.
It's not, yeah, terrible.
That's misselling. Misinformation.
It's all misinformation. It's all misinformation. This gives you loads of energy. Some people have fallen sick from drinking these. My daughter today said to me, Mum, someone at school came in and said they had drank 2 of these before class today, and I was horrified, absolutely horrified. So as well as really high hits of caffeine plus sugar, the heart is not going to like that.
Coke Zero, is that all aspartame? I can't remember.
So you've got Diet Coke and you've got Coke Zero, and they've got different types of mixture of sweeteners.
They're all mixtures.
I don't really have them, so I don't know exactly what's in them, but always read the label, I think is the advice there, and then choose. But again, it's not about never, it's about choices, yeah.
We were just mentioning about apps and whether there's an actual app that you'd recommend for scanning.
There is an app. I think I will mention that later at the end, if that's all right. And the reason is there are a few that are being developed.
There's one called Yuka.
Yeah.
That
Yes.
is good.
Yeah, I will mention it at the end when I'm not being recorded. And I'll give you a bit more info on that, if that's all right. Okay, and just finally, two little things here is that this is a milkshake. It's marketed to children, obviously. It's a milkshake. Now, milk has natural occurring sugars, so a lot of the sugar is coming from milk, which you could say is healthy. But again, it's read the label and see what else is in it before you make that choice. And then there's the lovely orange juice. Now, this doesn't have anything else in it. It is just orange juice. But what people maybe don't understand is that once you've taken a fruit and squished it down and stripped out all the fibre and the nutrients that come with that fibre, how it interacts in your body once you drink it is completely different to drinking, to actually eating the fruit. So it's not always the best choice. All right, I think I'll leave that activity there. I hope you enjoyed it, and we'll come back to any questions at the end. Is that all right? Okay. Let's have a sip. Any big surprises on those?
It's all horrifying.
Okay. All right, so I will now look at a bit more about what we could add into diets that can really help all these topics around, helping that inflammation and therefore helping any pain that you suffer with. So our lovely broccoli, green powerhouse, switching your oils to extra virgin olive oil is a really, really good one. We have chia seeds, tiny but mighty, I like to say, and they are a great source of omega-3 fats. And a nice little one there, who, if you like chocolate like I do, is just switching your chocolate to a good quality dark chocolate. So around 70% plus. If you can handle higher, then even better. And that's because they have natural polyphenols that are actually beneficial to us. The, comparison to the Cadbury's world of chocolates is not the same. So again, read the label. What else? We have some curcumin, so turmeric's active ingredient. So things like adding black pepper to turmeric helps activate that. So you can do that in your home cooking. There are supplement versions of it. Fermented foods are amazing for your gut, which is where all disease really begins. So being able to include things like kimchi, sauerkraut, or even kefir is a really good addition to any diet. And we have our berries, so raspberries and blueberries. Those are so lovely to eat. They are so beneficial and they have really good anti-inflammatory properties. Other plants that you might want to include, lentils and pulses. Feed those good bacteria and therefore reduce inflammation over time. So this is something you want to think about as including regularly into your diet. It's not just an occasional thing. So it does compound and then the effects grow. Okay, so what does it look like to have a pain management toolkit? This is what I've been developing for myself, and this is what I advocate and help people discover for their own needs. So things that I live by are intermittent fasting, sugar reduction, movement, Pilates, yoga, a gentle walk if I can manage it, which isn't always the case, vitamins and supplements, alternative therapies that we mentioned earlier. Using heat is really beneficial for me. Resting is not always easy, it doesn't come easy, and sometimes I have to ask for help in order to get the rest. That is something I've had to really push myself to do. And then there's meditation and breath work, which a lot of people here have mentioned. And my favourite is laughter. How good do you feel when you've had a good laugh? So just a few things there that might be something to think about for yourselves. So in summary, I'd really like you to take away at least one thing, and if you do suffer with any underlying conditions or any pain, I like to talk about building your toolkit. So if you can take away one thing from today, then I hope I have educated you. So chronic pain is complex, it's real, sometimes invisible. Inflammation plays a key role in that long-term pain, and the lifestyle factors that you choose really make a difference. So small, consistent changes in movement and how you go about your day can really make a difference as well. And adding in any complementary therapies, going and trying things for yourself, because what might work for one person will be completely different for the other. I work with people, like I said, on a one-to-one basis as well as other methods, and for today, if anyone of you here or anyone you know needs any personalised support, I have a half-price special offer for one-to-one coaching that includes 2 sessions and tailored support around what's needed for that individual. If that's something that interests you, please speak to me later. In addition to that, I have lifestyle masterclasses coming up in March, and I also have a free downloadable ebook, 7 proven actions for managing chronic pain. Scan the QR code and you can go ahead and download that ebook, and that will just talk about the different lifestyle factors that you can start thinking about for yourselves. My masterclasses, so the third masterclass is quite similar to this one on chronic pain and inflammation, and the other 2, if they interest you, are on cancer prevention, making small changes for big impact, and also understanding ultra-processed foods, and that's where I go into a lot more detail to help people understand how to read food labels and how to make better swaps. So please feel free to scan another QR code that has all my links and anything if you want to follow me on social media or get in touch in any way. Any questions?
Is that a different QR code?
Yes.
Didn't have time to scan the first one.
You'll be able to find it off this one as well. So if you can, in fact, I'll give out my cards later and it's got a code on it, so if that helps.
Can we just say back with the fasting?
Yep.
How long do you fast? What do you recommend that you do anyway?
Okay.
Because everyone's different, aren't they?
Absolutely. Yeah, so there's a complete variety on fasting and how you go about it. There are different techniques, different guidance around it. Personally, I try and do an average of 16 hours of fasting with an 8-hour eating window. And doing that consistently really helps reduce my inflammation, and I notice that in my pain management. There are longer fasts that can be done. Again, it depends on what the goal is for that person, what their life situation is, whether they're male or female, what stage of life they're in. So there's so many different factors that I couldn't speak about all of it right now. But yeah, really beneficial. Yeah.
Would you say that's because of after that place or with the fat burning or the cell renewal phase?
Autophagy?
Yes.
Autophagy.
Is that the key?
Autophagy is a good key. It's not essential though. So for someone who's starting on the fasting journey, even fasting for 14 hours, so imagine finishing eating around 8 p.m. and then eating about maybe 10 in the morning, that has benefits. So for some people that's just normal and that's great. As long as you're not putting anything in your mouth that is going to spike your insulin, you'll stay in a fasted state. Autophagy starts to happen after 17 hours, and that's the process of regenerating cells in the body. It's 17 is where you want to get to as a minimum for autophagy.
And then you recommend that every other day or once a week or something like that?
I can't recommend it, so it just, again, it depends on who you are and what you're trying to do. It could be something you do once a week, once a month, once a year. That would be better than nothing, but some people can do it every day.
One thing you didn't touch on, talking about pain, is painkillers.
Yes, that's because what do we do when we go to the GP? Do we get advice on how to go home and relax? No.
Curcumin is as effective as ibuprofen, but there aren't any safe painkillers. It's rather like talking about sweeteners, isn't it? In the papers today, they were saying aspirin has shot up in price. What used to be 18p's worth is now something like £3.
Oh wow!
So there's some problem with the availability. And then, all the non-steroidal anti-inflammatories, rot your kidneys and rot your gut, cause bleeding, etc.
Exactly. Yeah.
Even paracetamol and codeine are unsafe. So
they all have a place. They all have a place. It's not to say you can't take or you shouldn't.
Small place, if possible. If you're doing everything you're doing,
well, exactly.
You won't be needing to.
Well, that's right.
Help.
Yeah.
Yeah, I think that's my take-home message.
Thank you. Any other questions?
You mentioned Pilates. You do Pilates?
I do, yeah.
How is that one?
Absolutely. I've been doing that well over a decade, and it has been one of my lifesavers. So to be able to get out of bed in this stiff feeling of not being able to move, doing some Pilates, and again, it could be 10 minutes because that's all I have, can mean the difference of carrying on for the rest of the day or not, up to having doing a class for an hour, which of course would be better, but it's not always practical. So again, it's about what can you do? What can you do for yourself? What can you fit in?
You mentioned about gut health. Do you have any ideas on the benefit of doing a sort of stool analysis, DNA analysis of what the microbiome is, and then tailoring the supplement specifically on the results? I think I did that there was one of these conferences, the integrative medicine conference or one of those sort of ones, and they then sort of send you a supply of personalised supplements.
Okay, yep. I mean, if you're interested in that sort of thing, I would say it's definitely worth trying. I can't recommend it. I can't say it's going to definitely help, but I've tried it myself. I went through the Zoe, the Tim Spector sort of plan, where you do various tests, including the poop test. And you get a lovely set of information, and that has absolutely benefited how I eat. So for me, it was very beneficial. But I think, again, for someone who's going to do that, they need to be able to take on the guidance that comes with it and actually implement it into their lifestyle.
Sure.
Did you get the 30 different types of seeds that they...
I haven't done that because I can get loads of different seeds from the shop down the road and mix them up myself.
And you always recommend grinding them down up into them all up?
Yes, there are certain seeds. Yeah. So chia seeds, linseeds, they are better absorbed if they're ground down.
You mentioned olive oil on there. So if you're cooking with it, does that have a different effect? Yeah,
so oils can be a bit tricky. So with olive oil, you don't want to use it for deep frying. You don't want to use it on a very high heat because the smoke point can change the chemical reactions of an oil, and that's the difference between how they interact in your body and cause more inflammation. So I do believe you can cook with olive oil, and I do in my home, but I don't really fry for long. So again, it's how you're using an oil and what you're using it for.
Would you recommend coconut oil? Same, so I think that can change as well.
It can, it can. So there's pros and cons of coconut oil. Personally, I like it, but my family don't like it when I use it. So it's a bit of a toss-up, but it's better for high heat. So again, different oils and different heat points is how they make the change.